Good day, everyone. Welcome to Module 13C. Without wasting much time moving to what our topic is today, which is bathing, back rubs, and assisting with clean dressing. Bathing, back rubs, and assisting with clean dressing. So without wasting time, we move to the first module, the introduction briefly. So assisting a patient with regular bathing is important for patient health and for promoting self-esteem and healing. Patients who are recovering from an injury or from an illness, or people who have chronic conditions, or who are permanently disabled, or those who are dying or frail, they may require assistance with performing these essential tasks. And this is an important role or the important part of our job as a home health aid or a personal care aid. Now, the care plan will direct the home health aid or the personal care aid as to the frequency and the type of bath that should be performed for the patient. At minimum, the patient should have their face and genital areas cleaned daily in the morning, in the evening. The home health aid or personal care aid should offer to assist or provide the patient with every need, like the evening care. And this includes washing the face, brushing the teeth, and any other area that the patient wishes. Providing for personal care gives home health aides or personal care aides an opportunity to assess a patient's skin and communicate with patients about their thoughts and feelings. The home health aides or personal care aides should observe the patient's skin for changes in color, temperature, swelling, bruises, or open areas, or red areas, or even sores. So this should be documented and supervisor should be informed. So home health aid or personal care aid should always encourage patients to perform any personal hygiene task that they are able to provide assistance as needed. Now, some patients may be able to bathe or shower independently or with minimal assistance. Some patients will require complete or total care, meaning that the home health aid or the personal care aid will have to provide their personal hygiene care completely. If a patient is immobile, weak, or frail, bed base should be provided instead of what? Of risking a patient's fall in a bathtub. So never allow a weak or a frail patient to stand in the shower alone. And in this type of situations, a tub or a bed bath may be more appropriate for patients who are frail or who cannot walk, who are bedridden. The home health aid or the personal care aid can also shampoo the patient's hair in bed by using the shampoo tray. So all these are part of the personal care that can be given to the patient. Patients have rights to refuse any treatment, including bathing, maybe toothbrush, cleaning of special areas, and the likes. So the home health aid or personal care should provide education for the patient about the importance of bathing. And you try to find out why the patient does not want to bathe. Sometimes the patients may not want to bathe or do any other task at that moment, and you should be willing to do one maybe at later time. So you document the reason and why the patients refused, and you inform your supervisor. Then to provide assistance with a bath, the water temperature should be checked when you are providing such assistance, and temperature should not be greater than 105 degrees Fahrenheit. Now, you allow the patient to test water temperature to determine if it is comfortable for them. And it is important that when you are providing the assisted bit that the patient needs, privacy should be what provided. And this includes closing the doors, drawing the curtains, and limiting access to the area to others while the patient is bathing. Towels or bath blankets should also be used to cover the patient's body, exposing only the parts of the body that is being washed during that bed phase. Then you provide back rub after bed, before bed, or anytime the patient needs to help to relax. Uh, to do this particular procedure helps the patient to relax, and it is an important skill for a home health aide or a personal care aide. This is an excellent way to reach or to teach a patient how to relax, access their skin, and promote good circulation. So this section will explain the proper way to give a back rub and even bed based and other procedures. And finally, instructions for how to assist with changing a clean dressing is also provided. Home health aides may never perform sterile dressing changes. Now, what is the difference between a sterile dressing changes or a clean dressing? A clean dressing is just a kind of dressing that, the injury is not too invasive, just maybe a bruise, doesn't have to deal with internal, so it's not too invasive. But when it comes to an invasive wound, a wound that is quite deep and has a higher risk for infection, these wounds are mostly sterile and they're not done by home health aides. So personal care aides may not perform any type of these dressing changes. So we'll consider the procedure for what? Tub or shower bath. The tub or shower bath. The first thing we do is we explain the procedure to the patient. You don't just carry a procedure without letting your patient know what you want to do for him or for her. So you explain the procedure to the patient. You wash and dry your hands according to the proper hand washing guidelines. Then you assemble your equipment that you need, like your soap, your shampoo, your hair conditioner, the wash clothes, and the towels. Then you ensure that the bathroom is warm and comfortable. Take care it is not too cold and it is not too hot. And this is an example. Then you remove any fall risk hazards, such as maybe loose rugs on the floor, and replace any safety device in the shower as needed, maybe a shower chair, a shower mat, or a rubber. Then you ensure that the safety items such as the handrails and the grab bars are in good working order. Then immediately you inform the supervisor if they are not there, if they are not available. You turn on the water and test the water temperature using the base thermometer. And if the water is above 105 degrees Fahrenheit, you know that it's not good for bathing. Then you reduce the water temperature to at least, at most, rather, at most 105 degrees Fahrenheit. Then, if providing a bath tub, fill the bath there and test temperature before putting your patient into the tub. Then, tub baths are very warm showers. They can lead to a person feeling fainty or nauseous or even tired. So they should not last more than 20 minutes and it should be discontinued as the first sign of patient discomfort or patient weakness or when patient begins to complain of feeling was faint. Then you allow the patient to test the water. Sorry for the brief interruption. A call came in. So you allow your patient to test temperature of the water for their own comfort, and you adjust this as needed. Then you wash and dry your hands, put on gloves, then assist the patient to the bathroom. If the patient is ambulatory, you assist the patient as needed to undress, and then you transfer them into the tub or the shower. Undress the patient immediately before getting them into shower or tub. Then this prevents them from chilling. If the patient is independent, you can give them privacy to bathe. And if they prefer, that's if they prefer it. And if not, you can assist them and stay with them to give them any assistance they need. If you are leaving a patient unattended, please check them every 5 minutes or more, frequently as needed. And you ensure that the patient knows how to use safety items such as the shower chairs and the grab bars. Then if the patient is standing to shower, stay in the bathroom and monitor the patient's need for what assistance. And if they are weak, always stay with them in the bathroom, providing privacy as able. Never let a weak person stand to bathe or never leave them in the bathroom alone. Uh, you can stay in the bathroom and draw the shower curtain to provide what privacy. Communicate with them frequently to let them know that you are here or you are there to provide assistance when needed. Then the water should be turned off and the tub should be drained before assisting the patient to transfer out of the tub. Then, when you want to transfer the patient into the tub, how do you do it? If the patient is on a wheelchair, the face of the patient and the wheelchair should face the tub. Then, the between the grabs bar or the safety rails, so you lock the wheelchair brakes, then you raise the wheelchair footrest. Every wheelchair has a footrest. You raise the footrest. Now, using a gale bait or a special belt that is placed on the patient to assist with safe transfers, you ensure it will be secure, and then the patient has a shirt or a towel on. So with the gate belt position over their clothing, you this helps to prevent irritation or breakdown of skin. So you instruct the patient or you assist with what placing their legs one at a time over the edge of the tub. Then you ensure that their feet are planted firmly onto the top floor before assisting them with transferring into the tub. And you instruct the patient to grab onto the bars of the side, you grab onto the bars or the side of the tub, and then you assist them into the sitting position on the edge of the tub. Then use the gate belt to assist the patient to positioning and what provide a safe transfer. Now, when you bring the patient to a sitting position at the edge of the tub, you can now lower the patient into the tub by holding around their waist or holding the gate belt. Then you instruct them to hold the edge of the tub or the grab bars for support and for balance. But if you are using a slide board or a special board that is position the slide board onto the shower chair and then under the patient's buttock. So then you can assist the patient to move across the slide board in a small movement by lifting their bottom up and then down. So moving slowly across the board until they are on the shower chair. That is if they are using the shower chair. Never drag the patient across the slide board and then you move the wheelchair away from the tub during bathing. Place all supplies to be used during the shower tub, shower or the tub bed within your reach and also within the reach of the patient. And this is to avoid unnecessary stretching to retrieve items. If assisting the patients during the day, avoid bending over with your back. Remember, we talked about proper body mechanisms. So you avoid bending over with your back. You position yourself to be safe and on a safe working level as the patient's height. Then you may kneel on the floor using the cushion mask to protect your knees. That's if needed. Then you assist the patient to shampoo and condition their hair as necessary. You assist the patient as necessary with washing their body, can start with the patient's eye and their face, start from the head, using a clean wash cloth. Then you do not apply soap to the patient's eye. Then assist the patient to clean their genital and their anal areas. You can use clean clothes for these areas. Then you wash the patient's body from clean to dirty areas. This helps to avoid contamination of clean areas. Then you make sure all soap is rinsed off profusely. If the patient is an ambulatory patient, that means they can walk. You can only assist them with transfer out of the shower or tub, into and out of it. So cover the patient with a towel or rope during the transfer to prevent them from what from chilling. Then to assist patients out of the tub, if you are using a wheelchair, you can assist them to the edge of the tub. Then you bring the patient's leg. No, you assist them to the edge of the tub. Then you bring the patient's leg one at a time over the outer edge of the tub. Then you assist them back into the wheelchair and always ensure that the wheelchair locks are on during this transfer. Help or complete the drying of the patient. Can take care to carefully dry areas where there are skin folds like the underneath, the breast, and in the genital areas or the anal areas. You assist them with dressing, drain and clean tub or shower areas. Then you discard all the used linens, remove gloves, then wash and dry your hands. Then document the task after the completed and record any changes in condition or behavior of the patient. And this is the pictorial representation of helping the patient with bathing, dressing, as well as what cleaning. So now let's go through how to do the bed bath, or how do we do the what's it called, a bed tub. So you fill the basin with water, then you test the temperature like we said earlier. Then you take care of the water not to exceed what 105 degrees Fahrenheit. We said it before, and you make sure that the patient takes the water till the is comfortable. Then you can need to change the water during the bed bath so that it stays warm as well as both ends dry. Dirty. So you change water when the water is dirty, or you change when the water is getting cold. So when it's not comfortable, you change it. You always will check the temperature each time you change it or add water to it. And then always encourage the patient to assist as much as possible, because this promotes independence and also to form a mix with the wash cloth. That means to form a mix, you open the wash cloth on a flat surface, then you place your palm facing up with 4 fingers on the wash cloth, leaving your thumb out. I don't know how to explain that better. I think the picture is weakness. We are saying it now. Placing the palm on placing the cloth on your palm flat, then under your your 4 fingers under it, and your palm, leaving your palm out, or your thumb here out. Then you fold the wash cloth into thirds lengthwise around your palm. I don't know if you understand what I'm saying now. So your the cloth stay on your palm like this. You leave your thumbs out. Assuming this is the cloth, then you fold the cloth around, leaving your thumbs out. So your 4 fingers will be enclosed within the washcloth with your thumbs out. So then you straighten the wrinkles and then fold the clothes down and tuck it in the ends of the washcloth. I wish I could see something to explain better. But like assuming it's a cloth, wrap around your hands, then this side you fold it into the thumb here. Leaving your palm, you leave this thumb out. So wash and dry the patient from head to toe. You work on one part of the body at a time, and always move from the cleanest area to the worst in the least clean. You complete the front of the patient first, following them to wash their side and wash their back. Then for eyes, for face, for ears, and for neck, you wash the patient's face with a wet washcloth without soap unless that the patient requests it. And if the patient requests soap, take care of what it does and that the soap does not get into the patient's eye. You can start with the eyes and wash from the inner area of the eye, as the cornea, as the closest to the corner close to the water, the nose, as this. Start from here, then to the outer area near the temple, that means with the corner of the wash cloth. So you wash from here to here, you wash all the region. Then, if the patient asks, if the patient wants, you ask the patient, you don't like to use soap on their face, so if they want, they will tell you, and if they don't, they will let you know. So you wash their face from the middle outward using gentle strokes. Then you wash behind the patient's ears and their neck, like from the chin downward. Then you rinse with a clean washcloth and you pass them dry. How do you wash the arms or the axilla? You can start with the arm furthest to you, and the arm that is farther away from you. Let's say you want to wash your start and you're staying at the left, you start from the what? The arm at the right. So remove one arm from the blanket or the towel, then support the patient's wrist while washing the lower and the arm and the hands. Then you support the person's arm by holding their elbow. Then, when washing their upper arms, they can rest their lower arm on your forearm using gentle but firm strokes. You wash from the lower arm to the elbow area. Then wash from the elbow area to the upper arm and then to the shoulder. So you wash the axilla, that is the underarm, the armpit. Then washing from the lower arm upwards helps to promote circulation of blood back to the patient's heart. Then you rinse and you pat dry, and you repeat that procedure for the other arm. Then for the hands, you soak hands in a basin. Clean one hand at a time. You clean nails with a nail brush or as directed in the care plan. Then dry thoroughly. You ensure between the patient's fingers they are all well washed and dried. Then you provide nail care as assigned. So how do we wash the chest or the abdomen? You place a towel over the patient's chest and you lower the bed blanket down to the waist, taking care to keep the pubic area covered. Then this provides for warmth and privacy. Lift the bath towel slightly to wash the patient's chest, then keeping the patient partially covered. Then you wash the chest using long, firm strokes from the center to the out. Then for female patients, you can clean under each breast and dry them well. You wash the abdomen using long, firm strokes from the center to the out. And take care to wash and dry well under the abdominal folds. And these moist areas can harbor bacteria and fungi as well. So apply powder to these areas as selected by the supervisor and at the care plan as well. Then you pull the blanket back to the patient's chin and remove the towel and you can change the water. How do you wash the legs? Expose only one leg at a time. And we'll be mentioning for part that have two, expose only one at a time. Then you can start from the part that is farther from you. So you place the towel under the leg lengthwise so that the remains under the leg may remain dry. Then you wash from the ankle to the knee with a long, firm strokes upward. Then wash from the knee to the upper thigh. You rinse and you pass dry. Then remove towel and place underneath patient's foot. You remove the towel and place under patient's foot. Then after that, for the feet, now you place one foot at a time in the basin and ensure the water in the basin is warm. Then wash the foot between the toes, and you wash the foot and between toes with a washcloth. Rinse well and dry thoroughly, paying special attention that the area between the toes are well dried. And moistness between the toes promotes bacteria and fungal growth, so this area should not be moist. Provide meal care and assign as assigned in the care plan. Let me change the water. So when washing the perineal areas now, you place the towel underneath the patient's buttock and the upper thigh. You ask the patient if they are able to wash their own perineal area by themselves. If so, provide them with clean, warm, soapy water and a washcloth. Then you leave the room if the patient requests privacy. If clean the patient's perineum area, if you are the one doing that, use a clean washcloth and a warm soapy water. Only expose the perineal area, leaving the rest of the patient body covered. Um, Replace soiled clothes or soiled washcloths with clean ones as needed. Now, for female patients, when you are washing the perineal area, you wash from what front to back a single stroke. Now, use a clean area of the washcloth for each stroke. You wipe once, yeah, you wipe one side, then you use the other side. Like you wipe one side, then the other side of the labia majora. You wipe one side of the labia majora, then you wipe the other side of the labia majora. Then you spread the labia parts apart, and then you use a clean part of the washcloth to wipe from the front to the back on each side, using a clean part of the towel for each stroke, or the washcloth for each stroke. Then wipe from top to bottom, down the middle to the opening of the vagina. Then you clean the area between the vagina and the anus last, washing from what? From front to back. Never move from back to front. But this put the patient at risk for urinary tract infection due to the exposure of bacteria from the anal area into the cleaner vaginal area. Then you rinse thoroughly, dry them with what? A well blotting motion. Then for male patients in uncircumcised males, gently you pull back the foreskin towards the base of the penis. Then you hold the penis by the shaft, and using a circular motion, you wash from the tip to the base. Use a clean area of the washcloth for each stroke. Then you rinse the penis and pat it dry. Be sure to replace the foreskin in uncircumcised male by gently pushing it back to its normal position. If you forget to replace the foreskin, you can expose your patient to the risk of what? Injury, as the skin will cut off circulation to the penis, causing pain and swelling. You can wash the scrotum, taking care of it to be gentle. Then lift the scrotum up with one hand while gently washing the area underneath as well as the entire surface of the scrotum. Then you rinse and dry very well using patting motions. And you not use the same water that you have been using to clean the anal area and the genital areas on other parts of the body. How do you wash the patient's back? When washing the patient's back, you assist or position the patient onto their side or the stomach so that their back is facing you and they are in the center of the bed. Then you ensure that side rails are up on the side and they are facing outward. Place the towel so that it is slightly tucked under the patient's back to prevent bed linens from getting wet. Then you fold the blanket back only enough to expose the back of the patient. Then you wash the back of the patient's neck, then the actual back with long firm strokes. Then you rinse and you pat towards dry. Now when washing the patient's buttocks, so while the patient is on their side, you wash their buttocks too. Buttocks should be washed last. After you have washed the patient's back, never move from buttocks to back. Rather, we can move from back to buttocks. Always work from the clean to dirty areas, not from dirty to clean areas. You replace the soiled washcloth with clean ones as needed. Then you discard washcloths used to clean buttocks before moving on to a new area. then you change the water. Remember to change the water in the basin as needed. And when it becomes too cold or too dirty, you ensure that all the body parts are thoroughly dried. Then you apply lotion as needed and as requested, and even as ordered. So, applying incontinence products. What do we mean by incontinence products? Some patients may not be able to hold urine by themselves or hold feces, so they have incontinence. So some patients who are incontinent may wear disposable briefs to help keep them dry. And if the patient is able, they may bend their knees and lift their hips. To place the brief under the patient buttocks. If unable, you roll the patient to their side. You unfold one side of the brief and you tuck it under the patient. Then you check for correct placement of the brief. It should cover their buttocks and their groin area. The top part of the brief will be about 1 to 3 inches above their buttocks. Then you roll the patient to the other side and let them know that they will feel a bump from the brief as they roll over it. So you ensure that the bed rails are up. Move the patient to the other side of the bed. You move to the other side of the bed. Then you pull the other half of the brief from under the patient. Like you turn the patient on one side, you put the brief there, you turn to the other side, and you to assist the patient back to the supine position. That means patient lying in their back with their face up. Then you put the brief up between their legs. Then you peel the tape from the tabs and fold each side inward towards the front. And you secure the tape to the front of the brief. Then you give a back rub if time permits, and in the patient request, you ask the patient with as if they request it, then you give them, then you assist them with what? With dressing. Lower the bed to its lowest height. Ensure that the side rails are up for patient safety. Then you clean area and put away equipment and supplies. Remove your gloves, wash and your hands. Then you document the completion of tasks and record any changes in condition or behavior. The documents and report any skin issues such as maybe red or white areas, skin breakdown, open areas, rashes, or if there is any new bruises. So procedures to shampoo a patient on bed or in bed. Procedures in also shampoo a patient in bed. So the first thing we look at here is that washing a patient's hair helps to promote good hygiene and good comfort, relaxation as well as self-esteem. So it can provide a chance for home health aides or personal care aides to assist the patients and even to assess their condition, the condition of their hair, of their skin, or even their scalp. Then when you're washing the patient's hair in the bed, home health or personal care aides should ensure that the men and the patient's clothing are properly protected by using the towels or the waterproof pads under their shoulders. They always assess for allergies, the product being used, and style. You can style your hair according to what the patient's preference. Take care not uh, to pull on the hair, and also this could damage the patient's scalp. Then again, older patients may have a thinner and more fragile hair, so extra care should be taken when dealing with this kind of older patients. So this is an example of shampooing patient's hair. Now, what do? The first thing we do in every procedure is to explain the procedure to the patient. So what do we do here? We explain the procedure to the patient and you wash and you dry your hands, then put on the gloves. Assemble the equipment as the shampoo or the conditioner base, the base towel, and the hand towel, the pitcher, the shampooing basin, or the disposable shampoo cap. They ask the patient for preference of product and ensure the patient is not allergic to any product. Position the patient in a supine position. You can place a waterproof pad or towel under the patient's head and shoulders. Then you place the towel over the shoulders and the chest area to keep these areas and keep them dry and warm. Then you ensure that the rest of the patient's body is kept warm and covered with a blanket. Then you protect the patient's eye and face from getting wet because wet hair, then you wet the patient's hair by what? Pouring clean warm water using a pitcher over the patient's hair, starting from the hairline and the scalp and working towards what? The neck. So allow applying shampoo to your hands and rub them together. Work the shampoo into a lather, then working from the front of the patient's head to the ends of their hair. So you can use your fingertip to massage shampoo against the patient's scalp using a circular motion, or you take care of it not to use your hand to scrape the patient's skin or their scalp with your nails. Then you ensure that the soap and water does not get into the patient's ear or the patient's eye. You rinse their hair thoroughly until the water runs clear and no surds are visible. Then you rinse from the scalp line to the patient's forehead to the ends of their hair, protecting the patient's eye and their ears. If you are using a conditioner, repeat steps. Repeat the step 7 and step 9. And 7 to 9. If you count it, let's count it first from the first step. So 1, 2, 3, 4, 5, 6, 7. Apply shampoo to your hands and rub them together. That's 7 steps. So if you are using a hair conditioner, apply it again. You apply those steps again from that. Applying shampoo to your hair and to your hands and rub them against the hair. To the last one, rinse thoroughly. Then you do that. You do that often and often until the hair is clean. So if using a shampoo cap, you follow through step 1 through step 5. So apply shampoo cap to the patient's hair, tucking it in any loose hair ends so that all the hair is within the cap. You know what a shampoo cap looks like. Then massage the scalp so that the dry shampoo is evenly distributed throughout the hair and allow 1 to 5 minutes for shampoo to fully saturate the hair. Then you can now remove the cap and discard used cap. Dry and style patient's hair as you normally would. Then wipe water from the patient's face, head, and neck using a dry towel and a blotting motion. Then you dry and comb the hair according to the patient's preference. If using a blow dryer, ensure that the hot air and the tip of the blow dryer is not placed onto or too close to the patient's skin as it will cause a burn. So when working on untangling hair, hold a section of the hair above the tangle. This avoids painful pulling on the scalp. Like if there is a tangle, you hold this is the tangle you hold here to avoid pulling. Then gently comb through the tangle. Conditioner or a detangler could be used and could be applied to assist with removing those tangles. When brushing hair, you can brush hair in sections. Brush from the roots to the ends of the hair, then be gentle with your strokes because you are taking care not to harshly scrap the patient's scalp or not to yank on hair. Then, because this could cause injury to the patient's scalp. So once you are done with the hair care, you lower bed to its lowest height, ensuring side rails are up for safety. You clean the areas and you store your equipment that you have used back to its position. You remove your gloves, wash and dry your hands, then document completion of task and record any changes in condition or behavior. Record any changes in condition of the patient's skin or the scalp and as well as the hair. So again, we are going to be checking the procedure for back rub. How is back rubs given to patients? So back rubs can be given after bath, before bedtime, or after repositioning, and also to help the patient to relax. Now, back rubs helps to relax muscles, stimulate circulation, and what promotes sleep. Back rub lasts about 5 minutes. Back rub lasts about 5 minutes. Always ensure that it is okay to provide a back rub. The home health aide or the personal care aide must check with their supervisor and in the care plan. Observe skin conditions during back rubs for bruises, for redness, for white patches, or for open areas, and other signs of skin breakdown. Always report and record these observations in case of any. Then it is helpful to use lotion during back rubs to reduce friction and moisturize the skin. Lotion on skin also helps to prevent skin breakdown. This is an example of back rubs. Explain the procedure to the patient. Wash and dry your hands. They are going to the procedure proper. So you explain the procedure to your patient. You wash and dry your hands properly, and you use gloves as appropriate. You assemble your equipment like your lotions and anything like that you'll be needing at the patient's reference. Then warm lotion in basin of warm water by running or by running bottle under the warm water for a few minutes. Do not use very hot water to apply lotion to the patient's skin. Rub some between your hands rather than pouring directly onto your skin. This helps to lubricate your hands during the back rub and helps to warm the lotion so the patient does not feel too cold. Position the bed to safe working levels at waist height and lower the head of the bed. Lock the brakes, lower the bed rails nearest to you. So you provide privacy for your patients as well as you remove the patient clothing from only the area you are working on to minimize exposure. Then you keep the blanket on the patients, exposing only their back to provide warmth. When you are working on the patient's back, position the patient on their side or on their stomach according to their preference and their comfort level. You keep the patient covered, exposing their back only to the top of their buttocks. When you place a small amount of lotion in your hands and rub your palms together to warm the lotion and lubricate your hands, then caution the patient that the lotion may still feel cold or may still feel cool. So you rub the patient back with the appropriate pressure according to their preference. You rub back in a rhythmic motion into the correct direction rather. Then you start at the top of the buttocks near the lower back as the sacrum and move in a long, smooth upper stroke with both hands, using the palm of your hands to create a gentle pressure. Move your hands upward along the spine and across the patient's shoulder and then down their upper arms. Move your hands up and move your hands up over the upper arms, then back across the shoulders, and then you down along the back towards the buttocks. So you keep your hands in contact with the patient's skin during movement to prevent friction against the patient's skin. Then you repeat this for like 3 to 5 minutes according to the patient's preference, and you stop back rub if any time the patient reports discomfort or no longer wishes to continue. And if the patient wishes, you can gently knead the patient's skin to apply a gentle tapping motion upward along the patient back to their shoulders and their arms, and then back down again. So to knead skin, gently grasp skin between your fingers and thumb. Then you move from buttocks upward along the length of their back across their shoulders, and then you down over their upper arm. Work your way back down to the buttocks using the same motion depending on patient's preference. You can also speed up or slow down your movement and pressure. Be careful to only lightly massage. Be careful to only lightly massage over bony areas so as not to cause pain to the patients. And do not massage areas that are red or that have broken or irritated skin. Do not apply lotion to areas with rash or areas that have pain like redness or all those patches. Then do not remove dressings to apply lotion. Do not massage these areas. When you are almost done with the back rub, let the patient know so that they are prepared for the ending of their back rub. Wipe away any excess lotion and assist the patient with the dressing and position the patient for comfort. You can lower the beds to its lowest setting and ensure the side rails are up. Then you put away equipment and supplies, then dispose of any dirty linens. Remove your gloves and then wash your hands and dry your hands. Then don't forget to document the completion of the task and record any changes in condition or behavior. Report any skin conditions such as redness, whiteness, white patches, or open areas, or even pressure sores on the skin. Thank you very much. We have come to the end of this particular module. And just a brief recap on what we discussed so far. We talked about bathing, back rubs, and assisting with clean dressing. And here we mentioned the introduction aspect of it, as we talked about what bathing is and what type of bathing is appropriate for some kind of patients. Then we talked about how to bath a patient, starting from bathing them in a bed shop or a bed shower. Then we talked about helping assisting the patient on bed, and we moved to discussing how those beds can be taken from their face, their ears, their neck, and their eyes to the arms. Yeah, then goes about to the arms, the alveolar, the hands, chest, chest and abdomen, the perineal area, the feet. Also about for female patients also and even for male patients how we can wash them. And we also mentioned something that's very important, that you never wash from dry from dirty to clean, or rather from what clean to dirty to prevent the risk of infection. And removing infection from the dirty area to what the clean area. Then we also mentioned how we can give or shampoo our patient's hair in bed, and how we can do that perfectly to avoid harm that patients or hurting them. Then we also mention finally procedure for back rub, and we came to the end of the topic. Thank you for listening. Thank you for your time. Enjoy the rest of your day.